Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty.
Georgia, tell me what's going on with your elbow. What happened?
I have tennis elbow.
How long this been going on?
A month or so.
About a month. How did you hurt your elbow?
Playing tennis.
Playing tennis. So can you show me exactly where do you feel the pain?
Right here.
The whole area?
Here.
Here and here?
And in my wrist sometimes.
In your wrist. How much pain from 0 to 10 do you feel there?
Maybe 3 or 4.
3 or 4. At worst, how much pain do you feel there?
When I first got it, probably like 6 or 7.
Okay, that was a month ago. Okay. What aggravates your elbow symptoms? What make it worse? What make you feel like it's the pain increase?
Either when I try to play tennis or like lift something up or maybe like bounce the ball off my tennis racket.
Okay, so that's when you feel the pain. Did you have any treatment before coming here?
No.
Okay, so let me see. Okay. Can you straight your elbow? Okay, bend your elbow. Okay, so your range of motion is fine. Let me see your elbow now. Okay, bend both at the same time. Okay. That's fine. Okay, so do you feel pain here?
Yeah.
How much from 0 to 10?
Like 6 when you think of it.
When I touch, I feel that. Okay, so lifting does increase your symptoms. So what we're gonna do is actually, I will have you lift. This is 4 pounds, okay? And I want you to tell me how much pain do you feel there. So we can use that as a testing after the treatment. And tell me how much pain.
Maybe like 5 or 6.
5, 6. Let's do 3 times. Heavy?
Yeah.
Okay. How much now from 0 to 10?
The same still.
5 or 6. Okay, and where do you feel it?
Right here.
On the side.
And
Okay.
in my wrist.
In your wrist. So are you left or right-handed?
Left-handed.
Left-handed. Okay. So let me see. Did you play a lot of tennis? How did you hurt it? Like you had like any accidents or just overuse, overtraining?
Overuse. I played every day.
Every day. That's nice. How many hours?
Probably like 1 to 1.5.
That's a very good sport. Yeah. That's good. Yeah. I like tennis actually. You don't want to see me playing tennis. You will not think I'm playing tennis. I'm playing ping pong. Yeah, it's not. I play ping pong very well. Is that too much?
No.
Okay. Make sure you tell me if you feel pain. You feel this bump here?
Yeah.
That's a scar tissue. That's usually from like repetitive strain injury. You get micro tear in the muscle, and your body starts to build the scar tissue, and that's a lot of the time it's cause restriction in the muscle and just cause some pain. So is there any worse point that you have there, or the pain just all over the same? Like which area is the worst area of pain?
Like right here.
On the outside, yeah? Okay.
Maybe a little bit. I think like right here.
Right here, okay. So you really have a classic tennis elbow, and you get it from tennis. Make sure this isn't painful, okay?
That hurts a little
Sorry. Feel this bump here?
bit. That hurts.
Okay. So you have a little bit inflammation here. Let me see the other side. Roll it up. Okay. Yeah, it's a little bit swollen here. You can see it's just not too bad. Just a little bit. Is that hurt or is that okay?
It's okay. It hurts a
Okay.
tiny
I
bit.
want you to sit up nice and tall. We're working on it. Okay. Make sure that's not painful.
That hurts.
So when you feel pain here, what kind of pain? Is it numb, tingling, burning? What kind of pain, especially in your wrist?
Maybe like inflammation kind of.
Yeah. Oops. Oh, okay. Well, everybody's okay. Okay, not get on the patient or the cameraman or me. So just on everywhere else. That's the lotion. How's that?
It's fine.
Okay, you see that redness here? That's all scar tissue.
Mm.
See? Okay. Let's move your hair a little bit to the side because I don't want to get lotion on it. Okay. Feel that?
Mm-hmm.
This one. You hear that grinding here?
Yes.
That's a scar tissue. Feel it?
Mm-hmm.
I don't know if you can hear that. Can you hear it? No?
A little bit, yeah.
Yeah. Some patient, yesterday I had actually a video for a patient. It was so loud. You can hear it in the camera. I was like, man.
Does it hurt?
No, it was not hurting. It's just the scar tissue. Well, ASTR should not hurt, as long as patient communicate with us,
Yeah.
So, but it was loud. I changed the design and the material, and it's actually, you can hear it very easily. Yeah. Let's move your hair a little bit. So, let's roll this up a little bit, because I don't want to get lotion everywhere. It's actually very cool to hear it, So with those tools, you actually can hear the scar tissue. You can feel it. You feel the vibration. Patient can feel it, and you can see the vibration here. Can you see? You see the vibration? So it's easy to detect it with the tool. Sorry. Okay. See? You did a lot of back swings, yeah?
Mm-hmm.
Yeah, that's her triceps. See? And she has a knot here. Too much or it's okay?
Hurts a little bit.
Make sure what I'm doing is not painful, okay? Okay, let's do this side. Alright, let's move your elbow and tell me how that feels from 0 to 10. You get everything. Let's do this. Any pain?
No, not really.
Okay.
It hurts a little bit less.
Mm-hmm.
It hurts like maybe 2. Probably.
When you do that now?
Yeah, maybe
Where?
1. It
Where
doesn't
do you feel
really
it?
hurt. Just a tiny bit right here.
Right in there?
It
Okay.
doesn't hurt a lot though.
Okay. So the pain went down?
Yeah.
Okay. I feel cold. Okay. Let me know if it's too much, okay? Is that too much?
Yes.
Sorry. Okay. What about this?
Yes.
Sorry. Okay. Well, at least you're smiling, okay? But sorry. Make sure it's not painful. Yeah, you have some inflammation there, so let me do this gentle. How's that?
It's okay.
Okay. You still playing tennis, or are you taking a little bit break?
I've taken like a month off. I
Okay.
tried maybe a month ago and it hurted.
Okay. Well, we're gonna try the swing here before you try it, just to make sure you're ready to do that. Definitely have some inflammation, so we're gonna work on the inflammation after this. Is it too much?
No,
Okay, let's do this again. How's that?
it doesn't hurt.
It doesn't hurt. Okay, let's try. You remember how much pain was with the weight? Was 5, 6 or something like that with the 4 pounds? Okay, let's try it again and tell me how that feels.
Probably like a 3.
Where?
Here.
Okay. Went down a little bit. Right in here or up in here? Okay.
Definitely hurts less.
It hurts, yeah, it hurts less, and it's here. And I don't know, did you notice that it's start to shrink, like not the whole area when you complained before? Yeah, but you feel it like a line here. Is that correct?
Yeah.
It start and stop here?
Mm-hmm.
Okay. Sit up nice and tall. Okay. Make sure this is not painful. Is that painful? Yeah. Sorry. Okay. There you go. That's cool. You feel that scar tissue here?
Yeah.
Is it hurting while doing this, or it's okay?
It hurts a little.
Okay, make sure
Not a
you.
lot.
Okay. Well, I don't want to cause pain. Okay, let's move it again and tell me how that feels.
It doesn't hurt.
Okay, let's try the weight now and see. How's that?
Doesn't hurt.
So let's try it 2 more times. Good. Alright, so no pain? Awesome.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.